Certified nursing assistants, or CNAs, are the heart of healthcare. They stand on the front lines of patient care, providing essential support to nurses and direct comfort to patients. Their role is not just a job, it is a calling to serve and to care. CNAs assist patients with activities of daily living, such as bathing, dressing, and eating. They help patients move safely, preventing falls and promoting mobility. CNAs are keen observers, monitoring patients' conditions and reporting changes to the nursing staff. This vigilance is critical for early detection of problems. CNAs are indispensable in various healthcare settings, from hospitals to nursing homes and home care. The demand for skilled and compassionate CNAs is growing, offering stability and numerous opportunities. Choosing to become a CNA is choosing a path of profound personal fulfillment. It is a role where you can see the direct impact of your work every single day. Helping someone maintain their dignity, easing their discomfort, or simply being a friendly face can be incredibly rewarding. This career is about more than just tasks. It is about human connection. It is about offering support during challenging times. The gratitude from patients and their families is a powerful motivator. If you are looking for a career where you can truly touch lives, becoming a CNA is an excellent choice. CNAs form crucial bonds with patients, making a real difference in their daily lives. Their work is vital, requiring both skill and a compassionate heart. CNAs are the bedrock of daily patient well-being. Working as a CNA means upholding strong legal and ethical guidelines. These rules are the foundation of trust between patients and caregivers. Professionalism in every interaction is key, ensuring care is provided safely, respectfully, and fairly. A cornerstone of legal responsibility for CNAs is Chcp, which protects patient privacy. CNAs have access to sensitive personal health information that must be kept confidential. This means not discussing patients' conditions in public areas and being careful with patient charts and electronic records. Patient rights are paramount, and CNAs play a vital role in championing them. Every patient has the right to be treated with dignity and respect, to be informed about their care, and to make decisions about it. CNAs must ensure patients understand procedures and respect their choices. Professional standards and a strong code of conduct guide a CNA's daily practice. This includes being punctual, dependable, and maintaining a professional appearance. Communicating clearly and respectfully with patients, families, and colleagues is essential. CNAs have a responsibility to report any suspected abuse, neglect, or unethical behavior. Failing to uphold these standards can have serious consequences, including loss of certification and legal action. Integrity is key to protecting patients and elevating the healthcare profession. Adhering to these principles ensures a safe and respectful environment for everyone involved. Infection control is one of the most critical responsibilities of a certified nursing assistant. Patients in healthcare settings are often more vulnerable to infections. CNAs are in a prime position to break the chain of infection by diligently following infection control practices. Proper hand hygiene is the single most effective way to prevent the spread of infections. CNAs must wash their hands thoroughly with soap and water for at least 20 seconds, before and after every patient contact. Personal protective equipment, or PPE, includes items like gloves, gowns, masks, and eye protection. CNAs must know which type of PPE to use for different situations and how to put on and remove PPE correctly. Proper disposal of used PPE is also a critical step. CNAs contribute to infection control by maintaining a clean environment, regularly disinfecting frequently touched surfaces, and properly handling soiled linen and waste. CNAs must understand and apply standard precautions with every patient. This means treating all blood, bodily fluids, non-intact skin, and mucous membranes as potentially infectious. Adhering to these comprehensive practices helps create a safer environment for everyone. It is a continuous effort that requires diligence and attention to detail from every member of the healthcare team. Preventing healthcare-associated infections is a fundamental goal, and CNAs are key players in achieving this vital objective. By following infection control practices, CNAs protect their patients, themselves, and their colleagues. As a CNA, being prepared for emergencies is a fundamental part of your role. Healthcare environments can be unpredictable, and your ability to respond quickly, calmly, and correctly can make a significant difference. Fall prevention is a major safety concern, especially when caring for elderly or frail patients. CNAs play a crucial role in identifying patients at risk for falls and assisting with mobility. Fire safety is another critical area of emergency preparedness. All healthcare facilities have specific fire safety plans, and CNAs must be thoroughly familiar with them. CNAs must also be prepared to respond to common medical emergencies, such as choking, fainting, seizures, or diabetic emergencies. While CNAs do not diagnose or provide advanced medical treatment, they are often the first to notice a problem. Their role is to stay with the patient, call for help immediately, and provide basic first aid as directed or per protocol. Quick and calm action in these situations can be life-saving. Continuous learning and refreshing these skills are essential. Mastering essential clinical skills is the foundation upon which effective and safe patient care is built. These skills allow CNAs to monitor patient health, assist with treatments, and provide vital information to the nursing and medical team. One of the most frequent and important clinical tasks for a CNA is taking and recording vital signs. This typically includes measuring a patient's temperature, pulse rate, respiratory rate, and blood pressure. CNAs must learn the correct techniques for each measurement and understand the normal ranges for different age groups. Assisting patients with mobility is another core skill. CNAs help patients to turn and reposition in bed, transfer from a bed to a chair or wheelchair, and ambulate. Using proper body mechanics is essential for the safety of both the patient and the CNA. Accurate observation and diligent documentation are critical responsibilities that underpin all clinical care. CNAs spend a significant amount of time with patients, making them well-positioned to notice subtle changes in their condition, mood, or behavior. These observations must be reported to the nursing staff. All care provided, including vital signs, intake and output, and assistance with ADLs, must be documented accurately and promptly in the patient's chart. This documentation ensures continuity of care and communication among the healthcare team members. Good records are essential for good care. Providing personal care is a deeply intimate and essential aspect of a CNA's role. These tasks, which include bathing, grooming, and toileting, directly impact a patient's physical comfort and emotional well-being. A compassionate and respectful CNA can make a tremendous difference. By approaching personal care with sensitivity, patience, and professionalism, CNAs help patients feel clean, comfortable, and valued. Bathing and maintaining hygiene are fundamental to health and comfort. Grooming tasks, though they may seem small, play a significant role in a patient's self-esteem and overall sense of well-being. Assisting with toileting is another essential personal care task that requires utmost sensitivity and respect. CNAs help patients use bedpans, urinals, or bedside commodes, and assist patients to the bathroom if they are able. For patients experiencing incontinence, CNAs provide regular perineal care and change soiled linens or incontinence briefs promptly. Throughout these tasks, maintaining the patient's dignity is paramount. This means ensuring privacy, speaking respectfully, and being empathetic to any embarrassment or discomfort the patient may feel. The connection between good nutrition, adequate hydration, and overall health is undeniable. CNAs play a significant role in supporting their patients' nutritional and hydration needs. They assist with meals, monitor intake, and encourage fluids. Proper nourishment fuels the body's healing processes, boosts energy levels, and strengthens the immune system. Assisting patients with meals and ensuring they stay hydrated are key responsibilities. Some patients may need help opening packages, cutting food, or even being fed. CNAs must be patient and encouraging during mealtimes. Monitoring how much a patient eats and drinks and how much they urinate is often required. Beyond physical needs, CNAs also play a vital role in addressing their patients' mental and emotional well-being. Hospitalization or living in a care facility can be isolating and stressful. CNAs who spend considerable time with patients can be a source of comfort and support. Simply taking the time to listen, engage in conversation, or offer a reassuring presence can make a huge difference. Recognizing signs of emotional distress and reporting them to the nurse allows for appropriate psychological or social support to be provided. Supporting patients with cognitive impairments, such as dementia or Alzheimer's disease, requires specialized skills and immense patience. The goal is to promote their safety, dignity, and sense of security, even as their cognitive abilities decline. Caring for elderly individuals, often referred to as geriatric care, presents unique considerations. As people age, they often experience various physical and cognitive changes. CNAs working with older adults must be knowledgeable about these common age-related changes. The focus of care is often on maintaining function, promoting safety, and enhancing the quality of life for these individuals. A key aspect of geriatric care is promoting independence as much as possible. Understanding and providing end-of-life care is a profound and deeply compassionate part of a CNA's work. This type of care focuses on comfort and quality of life when a cure is no longer possible. The primary goal is to ensure the patient is as comfortable and peaceful as possible. This involves managing pain and other symptoms, providing meticulous personal care, and creating a serene environment. Providing compassionate support to dying patients and their families is a critical skill. CNAs can offer immense comfort through their presence, a gentle touch, or by simply listening. After a patient has passed away, CNAs may be involved in providing post-mortem care, which is done with the same level of respect and dignity. This aspect of the CNA role is challenging but also incredibly meaningful, offering a chance to provide solace during life's final journey. Reaching the end of your training is a significant achievement, and the final step to becoming a certified nursing assistant is the certification exam. This exam is designed to ensure you have the essential knowledge and skills to provide safe and competent care. The exam typically has two parts: a written or multiple choice test covering theory and principles, and a practical skills test where you demonstrate your ability to perform selected nursing assistant tasks. To excel in the written portion of the CNA exam, consistent study is crucial. Review your course materials, textbooks, and notes regularly. Many students find it helpful to use practice questions and sample tests. The skills exam requires you to perform several CNA tasks correctly in front of an evaluator. Practice these skills repeatedly until you feel confident and proficient. Once you pass your certification exam, you are ready to launch a rewarding career as a CNA. Job opportunities are plentiful in various healthcare settings. As you begin your career, remember that learning is a continuous process. Seek opportunities for further training and professional development. The skills and experiences you gain as a CNA will provide a strong foundation for whatever path you choose. You are embarking on a journey where you will make a tangible, positive impact on the lives of many individuals every single day.